Evening and thanks for joining us. I'm Kristen Copeland. Jason's off tonight. One of the long haulers of COVID, healthcare. Hospitals are hemorrhaging nurses as those left behind struggle to provide adequate care. Those low staffing levels are what brought dozens of nurses out on the picket line in Utica today. News Channel 2's Jolene Ferris has your top story, reporting on the hopes and fears they bring to the bargaining table.
No contracts! No peace! No contracts! No peace!
With current staffing levels, the St. Elizabeth Medical Center nurses in Utica say they have no peace. They worry their patients don't either.
We are stretched to try to do it the way we want to. We're beyond our capabilities. Patients deserve good care. They want a nurse to be able to sit with them for 5 minutes, to be able to hold their hand maybe, to teach them something, instead of being in and out and doing all task work.
Several dozen RNs carried signs and chanted outside St. E's late this morning and early this afternoon. They've been without a contract since 2019. One of the biggest concerns they bring to the bargaining table, staffing levels.
Med-surg is not in a good way. Those nurses out there are taking, 7, 8 patient assignments. It's really unmanageable. It's unmanageable to be able to expect to provide quality care to that many patients in an 8-hour or a 12-hour shift.
Union officials with the New York State Nurses Association out on the picket line with local RNs today say MVHS is not the victim of a dried up applicant pool.
So you're saying it's not just that there aren't bodies and nobody's applying, it's that they're not paying.
Exactly. When you're not competitive with the rest of the market, especially now in the time of COVID, when nurses can go anywhere else and find jobs for that pay better, that perhaps have better hours and better conditions, they're going to go.
MVHS says, quote, even before negotiations began, we gave 2% raises to all employees, which is a highly unusual action for an organization to take. We continue to work through the collective bargaining process, and we remain hopeful that we can come to terms on a reasonable and fair contract within the next few weeks. Union leaders say progress is being made, just not enough.
Certainly the travelers have helped pick up some of the pieces, but we're still shattered. We're beat up and we're tired. And we just want something fair that's going to help bring staff that's going to be part of the community, someone who lives here.
Next bargaining session is March 29th. Jolene Ferris, News Channel 2.